Hi, my name is Michael Woods. I'm the Associate Dean of Academic Affairs and an Associate Professor of Pathology. Today I'd like to give you a brief overview of our curriculum and what you can expect as a student at Burrell. So our curriculum is divided up into the preclinical curriculum and the clinical curriculum. The first 2 years of the curriculum is a two-pass systems-based curriculum. In the first year, we focus primarily on normal anatomy with using cadaver-based dissection. Both our Las Cruces and Melbourne locations, where our students work with our anatomy faculty on an actual cadaver to explore and learn the basis of human anatomy, as well as normal physiology, teaching the principles of clinical practice, osteopathic manipulative medicine, as well as our mission medicine curriculum. In the second year, we move on to focus on pathology and pharmacology and the basis of clinical reasoning. The clinical curriculum in years 3 and 4 is where you learn to become a doctor, working with our preceptors in the basic core clerkships of internal medicine, family medicine, pediatrics, and others, as well as elective clerkships of your choosing before going on to graduate and move on to residency. One element of our curriculum that makes us really unique is the mission medicine curriculum. This includes didactic elements on humanism, biostatistics, epidemiology, and the social determinants of health. So we also send our students into the community to work directly with nonprofit agencies, with school districts, with other organizations that are working with members of the community so that our students can get an appreciation for the other aspects of life that influence their patient population's health. Some of the opportunities our students have that are also unique include a distinction in rural medicine for those students who rotate at some of our rural regional academic centers, as well as a distinction in research as an option for students who want to make research an integral element of their education. Some of the opportunities in research include a summer research experience during the preclinical years, as well as ongoing research opportunities during the clinical years with our preceptors. Some students go on to earn the research distinction. Many of our students end up presenting their research at national meetings where they get to interact with their peers as well as those that they hope to work with one day. We're really lucky here at Burrell to have access to some exceptional research facilities where students can do traditional lab-based research as well as human physiology research and research related to osteopathic manipulative medicine. We're also really fortunate to have a unique relationship with 2 research universities, New Mexico State University in Las Cruces and the Florida Institute of Technology in Melbourne, which have expansive research programs that create really unique opportunities for our faculty and for our students. So we are 1 college, 2 locations in Las Cruces, New Mexico and Melbourne, Florida. Our preclinical curriculum includes elements of both asynchronous content as well as synchronous delivery between the 2 locations with faculty at both locations who are working closely together to bring you the best quality education you can get.